All right, well, we don't have anyone jumping in just yet, so what we might do then is switch this over so that we will have 5 minutes reading on the clock. We will do this case as if someone was jumping in live with us. Case number 1, and our time starts now. All right, so we might turn this into a bit of a case discussion then. Because what we have here is, and what I would take for this sort of approach would be an ask, assess, advise, assist, and arrange kind of approach here. So if we think about what are the systemic inequities that contribute to poorer health outcomes for Indigenous Australians, particularly those in rural areas, we're going to have multiple options here. We have systemic inequities, including limited access to primary care, particularly in those rural and remote areas, with associated socioeconomic disadvantage as well. That's going to be low income as well as high cost of nutritious food. There's going to be a historical and cultural distrust of the healthcare system, particularly as has been hinted at with previous poor engagements or interactions, and geographic isolation as well, with limited ability to actually access across distances. Additionally, inadequate healthcare infrastructure and workforce shortages is particularly relevant to rural areas, which also leads to increased gaps to consistent care for chronic diseases like hypertension and diabetes, both of which disproportionately affect our Indigenous populations. To assess, we're looking at what specific health disparities might David in particular face due to these social determinants. So he's going to be at increased risk of poorly controlled diabetes and hypertension, which can lead to complications, predominantly cardiovascular disease and kidney disease. His limited access to health services, combined with a high prevalence of chronic disease in Indigenous communities, place him at high risk of complications. Additional food insecurity and limited availability of healthy foods contribute to poorer health outcomes, and his chronic back pain may worsen without regular healthcare follow-up and management. In terms of culturally appropriate management, so how could you actually approach cultural sensitive communication and healthcare delivery in this particular case? Build trust by engaging with active listening, acknowledging past experiences is incredibly important. Use clear, respectful language and tailor your language to David as well. Avoiding medical jargon, if possible, involve an Indigenous health worker if there's one available, or a community liaison officer to provide that culturally appropriate support and address any language barriers. Tailor that education around, in particular, hypertension and diabetes to his cultural context and engage in a gradual change. This is going to be a very long-term plan, particularly focusing on diet and lifestyle, so that it's targeting the things that are actually within his control to some extent to be able to make effective change. So in terms of that practical support and assistance, the assist stage, what specific support or interventions can assist David in managing his health conditions? So arrange follow-up with the mobile health unit for blood pressure monitoring, blood tests, diabetes management like HbA1c checking. Consider arranging telehealth consultations if possible with a GP or chronic disease nurse to improve continuity of care so he's getting more timely follow-up. Providing dietary guidance that takes into account the limited food that is available and the cost of it as well. And if available, connect him to a community support program that can offer things like transport assistance to healthcare appointments or possibly even subsidised healthy food. For follow-up and community resources, this arranging. So how could you arrange this support? As we've said, schedule regular visits with the mobile health unit. Consider the telehealth follow-up. If possible, try and link in with Indigenous-specific support services such as the Aboriginal health services or co-ops, community outreach programs for chronic disease management, and at the very least, arranging that follow-up with the next time you plan or another person from your team plans to actually be in that region for him specifically, and give him options for health services for urgent issues. So should his condition progress, should he develop complications, he actually has an actionable plan in place of how to approach that. Make use of things like Indigenous health checks to make sure that as much other preventative actions are taken into place. Make sure he's engaged in programs such as Close the Gap in order to subsidise medications and also make sure his immunisations are up to date and tailored to the Indigenous immunisation schedule, ensuring that he's not just up to date with the standard schedule. This is a very sadly common case for a lot of Australians, and I think it's a really important case to highlight the inequities experienced by our Indigenous population. As you can see again though, we've only used 5 minutes of our time here. And I'm sure you sitting out there probably even have a few more things you feel like you could add to a case like this. And so remember, we're not trying to trap you. We're not trying to trick you. This is all things that you're going to encounter day to day. And so don't feel like you're going to get any surprises there. So the feedback for this case, the competent candidate should be demonstrating understanding of the social determinants impacting our Indigenous health, Indigenous Australians, including an influence of the socioeconomic and geographic barriers. Address systemic inequities with tailored advice based on that patient's unique circumstances. For communication, making sure you're using culturally sensitive explanations and offering support to help build trust in the healthcare system. And addressing the patient's specific concerns empathetically, acknowledging the impact of health inequities. For your evidence-based practice, I want you to be applying knowledge of Indigenous health challenges, including the importance of mobile health services, telehealth and community outreach, as well as, and should be popped into there as well, our Indigenous liaison officers, and providing a holistic, culturally appropriate management plan with a focus on continuity of care and preventative health.